Chronic kidney disease or CKD is a long-term condition where the kidneys become damaged over time and can't filter blood properly. Healthy kidneys remove waste products and excess fluids from the body through urine. But in CKD, the kidneys gradually lose this function. CKD often develops slowly and many people don't notice symptoms in the early stages. But as it progresses, waste can build up in the body, leading to serious health problems. This condition is very common among older adults. Why? Because as we age, our kidneys naturally lose some function. Also, older people are more likely to have conditions like high blood pressure and diabetes, which are major risk factors for CKD.
Older adults with CKD are at greater risk for complications including anemia, bone and mineral disorders, heart disease, fluid overload, electrolyte imbalances, fatigue, and confusion.
So, what is the roles of nurses in patients with chronic kidney disease, especially in geriatrics or for older adults? We have early detection, we have to monitor blood pressure, urine output, and lab results. Next is patient education, teaching older patients and their families about kidney-friendly diets and avoiding harmful medications. And we have medication management. Also, it is very important that we have emotional support because CKD can cause stress, depression, or fear. Nurses help provide guidance and encouragement. And lastly, we have to coordinate care, working with doctors, dietitians, and social workers to ensure a holistic approach to the patient's needs.
So here are the physiological changes and common symptoms of CKD in elderly clients. First here is decreased glomerular filtration rate, also known as the GFR. This is a primary indicator of kidney function. A lower GFR means the kidneys are less efficient at filtering wastes from the blood. Reduction in nephrons. The number of functional nephrons, the filtering units of the kidneys, decreases with age, often due to glomerulosclerosis, scarring of the glomeruli. Another here is changes in renal blood flow. Reduced blood flow to the kidneys compromises their ability to filter effectively. Another is hormonal changes. The renin-angiotensin-aldosterone system, also known as the RAAS, is crucial for blood pressure regulation, becomes less responsive with age. Erythropoietin production stimulates red blood cell production, also decreases, contributing to anemia.
So next is the common symptoms in elderly CKD patients. First one is the fatigue and weakness. Reduced kidney function can lead to waste buildup, affecting energy levels. Loss of appetite and weight loss. Uremic toxins can affect the appetite and nutrient absorption. Swelling, or also known as edema, fluid retention due to impaired kidney function can cause swelling in the hands, feet, ankles, and face. Itchy skin and shortness of breath. Waste buildup can cause dry and itchy skin. Also, fluid buildup can affect the lung function. Muscle cramps. Electrolyte imbalances contribute to muscle cramps. Changes in urination. Increase or decrease frequency. Foamy urine. Nausea and vomiting. Uremic toxins can cause gastrointestinal distress. And lastly, cognitive changes. Uremic toxins can also affect the brain function, leading to confusion or difficulty concentrating.
So, their daily living is affected because older adults often struggle with both basic and instrumental activities of daily living, such as bathing, dressing, managing medications, and finances. Also, their cognitive and emotional well-being declines because there is an increased risk of cognitive impairment, depression, and apathy, worsening independence and mental well-being. It also reduces quality of their life because the combined burden of physical decline, cognitive issues, and emotional distress leads to significantly lower health-related quality of life and higher care dependency in elderly chronic kidney disease patients.
Here's a simple explanation of how CATS index works.
Here is a sample
The CATS index of
image
independence in activities of daily living
independent
checks how well a person can take care of themselves in daily tasks. Here's how it works. There are 6 basic activities. 1. Bathing. 2. Dressing. 3. Toileting. 4. Transferring. 5. Continence. And 6. Feeding. For each activity, the person gets 1 point if they can do it alone, meaning to say, they are independent, and 0 points if they need help or can't do it, meaning to say, they are dependent. The points are added up to give a total score from 0 to 6. What the total score means: 6 is full function or can do all activities alone. 4 is moderate impairment, needs help with some activities. 0 to 2 is severe impairment, needs help with most or all activities. In short, the higher the score, the more independent the person is. Here is a sample CATS score interpretation. A patient with stage 4 chronic kidney disease, in bathing and continence with a score of 0, it means that they are dependent or they need support. While in dressing, toileting, transferring, and feeding with a score of 1, meaning to say they are independent or they can do it alone. With a total score of 4/6, moderate functional impairment, meaning patient may live independently but need support with hygiene and continence.
Chronic kidney disease is a serious condition that becomes more common with age due to natural kidney decline and comorbidities like hypertension and diabetes. In elderly patients, symptoms may be subtle at first but can progress to fatigue, swelling, and confusion. Using tools like the CATS index helps assess their ability to manage their daily tasks and guide care planning. Nurses play a key role in early detection, education, and support, improving patient outcomes and quality of life through personalized care.